Jennifer asked, when is the appropriate time to test for PDL1? And she asked because she had a family member who had received chemo for stage 4 lung cancer, now seems to be in remission, but the family member had not been tested for PDL1.
Yeah, so that's really, are you a cancer researcher, Jennifer? So that's actually an excellent question, and we've asked this ourselves. I'll tell you, my initial assumption was that PDL1 might change dramatically from one time point to another time point. The preliminary data that's coming out suggests that maybe this isn't really the case, that PDL1 is a little bit more constant. So when people have done those studies of checking PDL1 at diagnosis and then at recurrence or at progression, it seems to be a little bit more consistent. So when do you check it? So there's a couple of answers to that question. I guess the real answer is you check it when you're going to be using immunotherapy. So in this setting, so that Jennifer specifically asked, that's sort of an interesting question. So right now, I mentioned to you about the initial treatment, that's targeted therapy, immunotherapy alone, or immunotherapy plus chemotherapy. There's also a lot of data that came out a couple years ago of looking at immunotherapy in the second-line setting, exactly like this, after a patient has progressed from initial chemotherapy. And in that setting, there actually are 3 approved drugs. Pembrolizumab is one. And then the other 2 are nivolumab and atezolizumab. Now, of those 3 drugs, only pembrolizumab requires, documentation that there's a PDL1 expression of at least 1%. The other 2, nivolumab and atezolizumab, were approved, I think, in 2017 without requiring. So in theory, at this point, you can use either atezolizumab or nivolumab at progression without caring what the PDL1. Now, PDL1 status may show prognostic impact for both nivolumab and atezolizumab, but it's not required to get those drugs. So you could say one or the other. Then the final thing I'll say is that the turnaround time for that, it sort of depends, I guess, upon where you are. But at our center, it's basically 2 days because that immunohistochemistry, the technique that they use to do that, is a very quick turnaround time. So there's a relatively, you can withhold that testing if you want, or you can test. I think either one is an okay answer.